So, welcome to Kai Porter, a pharmacist who was one of our awesome volunteers. Kai, it's really lovely to see you today. How are you doing?
I'm doing it well, thanks, Donna.
So, you're a registered pharmacist, is that correct?
Yeah, that's right.
And you're currently working, it's a retail pharmacy at Stanthorpe.
Yeah, yeah, very chilly little town.
Is it warm there today?
No, it's
No,
freezing.
it's
I've got fluffy socks on underneath the table.
oh, so do we all.
Yeah.
So can you tell us your migraine story?
Yeah, so I think I'm kind of at the start of like discovering the treatments for migraine and like kind of discovering what works well for me and everything. So I only really started realizing like the headaches and all the pain I was having kind of in late high school was migraines when I started university, when I started studying pharmacy, because then I was like, oh, during one of the lectures, I was like, this sounds a lot like me and a lot of these things apply. But I just didn't really know how to bring it up to doctors or what other like treatment options I could try. I thought like the over-the-counter options were fine for me. They were doing enough. And then it progressively got worse and worse and worse until like probably middle of university. It was almost a daily occurrence. And yeah, getting to the point it was pretty bad. And then finally I got a GP I like felt comfortable with, discussed a lot of different options, and yeah, I'm on a preventative option now, so I'm doing a lot better, and yeah, got a lot more things in my toolkit.
Was it a lecture on migraine that you?
Yeah, it was a lecture on, I think, neurological conditions, so it was chucked in there with like stroke and Parkinson's and a bunch of other things as well. So it was only like a little brief section, but they still went through a bunch of things, but.
So just to clarify, a degree in pharmacy, is it sort of part medical, part science degree?
Yeah, it's broken down into like a lot of different courses. So I went to the University of Queensland and we did science-based courses. So we had chemistry, we had like biology, then we also had like patient-specific and medication-specific courses that targeted looking at like the actual medication uses and how to talk to patients about them and like counseling and them and that. And then we also had like compounding classes where we learned how to make medications and like details about like what makes specific medications work in the body and things like that. So it's like learning about the conditions, the treatments, and then also like the science behind each of the different treatments and conditions.
That's fascinating. I love talking to
Yeah.
non-medical pharmacists because they just have so much knowledge on how are you feeling and is
Mm.
something else going to impact you or like I'm on first name terms with my local
Yeah.
frequent flyer I am. Um, Now, before we continue, we're just going to highlight that all of this information we're talking about today is general information only. It obviously doesn't apply to your own specific situation because everyone is different. So if you have any questions or concerns, please make sure you talk to your GP or your neurologist, um, even your local pharmacist.
Yes.
Like Kai. Kai's always around. So Kai, would you suggest that people generally stick with the same pharmacy?
Yeah, I found like since I've moved out to Stanthorpe for my internship, since we're one of the only pharmacies in the kind of area, a lot of people come to the same pharmacy each month for their medications. And I've actually found it's been really useful because I've had a lot of chats, like especially migraine specific. You can tell when people are really struggling with their migraines because they're coming in like 3 times a week for their triptans or other medications. And then it just really opens up the opportunity to have a chat and you build a bit more of a relationship because, yeah, if you only see them once every year, they probably don't really want to talk to you that much. They probably just want to come in, get their things, leave, and continue with the rest of their week. Whereas, yeah, out in this community, things are a lot slower and you have a lot more of a connection with people. And yeah, I
And
think I've been able to help a lot more.
that's actually my experience too. A couple of years ago, I had a migraine. I was at my local pharmacy, and it was actually the pharmacy tech that kind of looked at me and said, "Well, you've tried pretty much everything, haven't you?" And I just listed off a million things that I've tried from acupuncture to
Mm,
Reiki. And she said, "Have you heard about these new CGRP medications?" And she
mm.
said, "Make sure that you go to your neurologist." So I did, and then I ended up on Botox, which is a bit of an aside. But the point is, I wouldn't have known to keep looking if the pharmacy lady hadn't told me. So I love pharmacists. I think they're really
Yeah.
important
It's
people.
really hard to tell kind of what's out there just as like a consumer. Like you wouldn't know. Like a lot of people, even like simple cold and flu things,
Mm.
they think they have all the remedies at home. But when they come in, they're like, oh wow, this
That's
new
new.
thing's actually really good. Oh, so yeah, it's like a lot of things. Like it might seem like there's nothing more we can offer you, but if you ask us, we can probably find a better option out there.
So, what would you say? I do occasionally visit one of those pharmacies,
Hmm.
the big discount counter brands, because obviously everything there is cheaper.
Yeah, yeah, yeah,
And if
definitely.
I go up and I want advice on a medication, I actively have to seek out the pharmacist because they're usually hiding somewhere.
Yeah,
How do you?
usually I think the structure of most pharmacies currently is there's like a back counter bench and then the pharmacists are behind. So pharmacists are usually keeping an eye on the conversations that are happening and everything like that, and then checking over your medications when they dispense. But yeah, usually you need one of the assistants will need to come grab us and then take us to the customer so we can have a bit more in-depth
So
conversation.
if I go in and I'm
Yeah,
not getting the information, I can absolutely say, "Oi,
100%.
find
Yeah,
a pharmacist.
yeah.
I want to chat."
Yeah, definitely. Yeah, we're more than happy to come out and have a chat. We love having a chat about medications. We're all quite nerdy at that. And lots of us don't shut up when we start talking. So yeah, we're more than happy to have a chat with anyone.
Now, what were you telling me before about a medication review?
Yeah, so you can actually get medication reviews in the pharmacy. So one of the services we offer is you can actually sit down with a pharmacist and go through each of your medications. So say if you're like feel that either a medication's not working well, you have lots of different medications and you're having trouble managing taking multiple different doses each day or using like one of the injectable medications, like you're really struggling to use the device, lots of different things. Like if you're just confused, don't know what you're doing with any of it, you're welcome to like ask for a medication review with a pharmacist, and then we can take you into the consult room, sit you down, go through your history of medications, do a bit of problem solving, and then at times we can also like give advice to the GP as to what's kind of happening, like what might need to be investigated more, when what changes we've made in the pharmacy, like maybe dose boxes and things like that that have helped
Cool.
patients. So
So that would include if people are struggling with their CGRP injections. I've seen some questions and people getting awfully confused about,
yeah,
do I
some of them are
click
very
one way and then
challenging.
back another way? And someone
Mhm.
held something for 10 seconds, but then there wasn't a
Yep.
click. So they can all just go to
Yeah,
the local
come in.
pharmacist and say, help me.
Yeah, yeah. So we're not able to administer the medication, well, here in Queensland at least, but we can definitely like go through the device. And usually a lot of the times we'll have like a demonstration device that we can show you each step very carefully. And then we might be able to supervise you like actually administering the medication and make sure you're following through each step
So is
correctly.
that a bit like the air hostesses on the plane with their fake life jacket?
Yeah, literally like plug this in, do this. Yeah.
I will remember that.
Yeah.
Okay, so we might go on to, I've got a list of questions, things I always wanted to ask my pharmacist, but was
Yeah,
afraid.
go for it.
Okay, so mixing medications, how to tell if it's okay or if it's not. I mean, I hear all the time people say, the aspirin bomb and they might mix it in with Coca-Cola or something. Is there a general rule of thumb where you can say, yep, that's good, or no, that's bad?
Yeah, so usually we class medications into certain classes. So paracetamol is on its own. Then there's the anti-inflammatory medications like your ibuprofen, aspirin. Then there's like nausea medications, and then there's triptans. Tends to be like one medication from each class can usually be mixed together safely, but mixing medications within the same class is not a
And
recommendation.
really
So
bad.
you wouldn't have like an aspirin and an ibuprofen
Mhm.
at the same time, but you could have your ibuprofen and paracetamol, for example, or sometimes like an anti-nausea medication and like aspirin. It can really be beneficial sometimes.
Okay, so you've got to figure out what class they're in.
Yeah,
And
yeah.
if you're in doubt, ask a pharmacist.
Yeah, just ask us and yeah, we can kind of like write up a sheet. Like we do a lot of problem solving and I've got quite creative sometimes on how to get patients to know when to take certain medications because a lot of other pain medications have paracetamol combined in with
Yes.
it. And then it gets a bit challenging because then they don't realize that that's the same paracetamol that's in there, like other paracetamol tablets, and then they end up taking too much of that.
Yeah.
So yeah.
And don't get me started on like the 5 million names that each
Oh yeah,
medication
yeah.
is
Every
known
single
by.
different brand that's available in every single different pharmacy. So yeah, there's a lot of education that goes into our role and making sure like patients are informed about the exact drug they're taking, why they're taking it, how to take it, and everything like that.
So, talking about how to take medication, what about taking meds on an empty stomach?
Yeah, so one of the medication classes, so the anti-inflammatories, we always recommend to take on an empty stomach because they can be a little bit harsh on like your stomach lining and that. But each other medication tends to usually be fine to take in on an empty stomach, especially if you're feeling really trash and nauseous and feel like you can't get anything in, then
Because some people literally can't even keep water down when they're having an
exactly.
attack.
Yeah.
So,
Yeah.
what about there's a lady who lives around the corner and she
Mhm.
always talks about putting a lining on her stomach before she takes medication. I think she has porridge. Is that a thing or is this one of those old wives' tales?
No, no, it's definitely a thing. So it's mainly like the anti-inflammatories that can be quite harsh on the stomach. So yeah, any bit of food you can kind of get in. It doesn't need to be like porridge, like a thick lining, essentially. It's just having something else
Something.
in your stomach
So
at
what
the
about
time.
coffee? Because coffee is basically my breakfast.
I was going to say if it has milk in, then it kind of shelters it a bit. But if you're having black coffee, it's yeah, basically just caffeine and water and probably be even harsher on your stomach.
Excellent. I feel like we need to have more conversations about this.
Yeah.
Um, can you comment on some of the community's favorite hacks? So, I mean, we've spoken about the aspirin bomb. Some people actually dissolve the aspirin in the Pepsi or the Coke before they drink it.
Yeah.
Is that going to help or is that just a placebo effect?
I wouldn't advise against dissolving the aspirin in Coke because the particular medication, like the aspirin's only being tested in water and like it's specific to the water's like pH and all this like other factors.
Okay.
So you can't necessarily guarantee if you're dissolving it in a carbonated acidic beverage that it's going to dissolve the correct way and you're going to get the proper amount of the
You're
medication
not
or
going to get the
most
desired
effective way.
effect.
I don't know. That's just me thinking about it, but I suppose it's no different to having like dissolving your aspirin in water, drinking it, and then
And it
having
hits your
Coke.
stomach
I
acid
don't think
though.
there would be any difference, but it's just, yeah, like we want that aspirin to dissolve right, and you don't
Yeah.
want to have anything
So it
happen.
could actually make your aspirin less effective by putting it
Yeah,
into the acidic
potentially. Like I haven't
environment.
looked at the actual studies involved, but I feel
It,
like it could alter it
it
slightly.
sounds like it's a thesis project for you.
Yeah, definitely. Yeah. Needs more research. Hmm.
Um, okay, so what about the CGRP medications? What are the main ones that are available at the moment? Let's list them for the people like me that can't think of them.
Yeah, so the main ones we usually see in community pharmacy is your Emgality and Ajovy, because they're a lot easier to access under the pharmaceutical benefits scheme. And then there's a couple other ones as well, but we don't usually see them because no one really wants to pay over
Because no
hundreds
one
of
can
dollars
afford
a
them.
month for a medication. So yeah, pretty much, yeah, Ajovy and Emgality are the two main
Are the
ones.
main ones.
Yeah.
Okay, so then what about the PBS restrictions are different for each of those medications, aren't they?
Yeah, I believe the restrictions changed a little bit in the last like couple weeks or so, and I think
Yeah.
they're pretty much in line with each other now, except
Right.
for the continuing like treatment. So the initial treatment of the medication, like the PBS restrictions are pretty similar, but I think the like continuing script is still a
So
little
it
bit.
did change
Yeah.
recently that certain ones can now be prescribed by a GP. Like they can
Mm,
continue the prescription as opposed to having to go
yeah,
to
the
the neurologist
neurologist
every
each
time.
time. Yeah.
Okay. What sort of do you, okay,
It's a bit challenging. Like
it
I'll
is,
just
I
have a look
know,
at the PBS like website each time because like you have the drug listed and then like all the restrictions are like a whole checkpoint.
underneath.
They change all the
So
time, so it's hard to keep up with.
I know it does talk about things like you must have failed two of the old school
Yeah,
preventative
that's
medications.
really frustrating.
Is there a time period? Like, is that within a 12-month period or?
No, so usually it's just over the course of your life. Like it doesn't have to be within a certain period. Because one
Okay.
of the challenging things that I find getting people started on like prophylactic medication, the preventative options, is each of the other options, so like your antidepressants or your blood pressure medications or anti-seizure medications they use for like migraine prevention, you have to trial them for 8 to 12 weeks in
Mhm.
order to assess whether they're
Get the full
effective.
effect.
And that's at that particular dose. And then you have dose increases that happen and then dealing with all that in between. So you're looking at, you probably have to be on this medication 6 months at least to assess
Yeah.
whether it's effective. Then if
Before
it's
you can be assessed as
effective,
having failed. Yeah.
yeah, and then you have to go to another one and do that
Yeah.
whole process all over again. And then
Yeah.
another one. So you're looking at probably like 2 years of
2 years.
trying different tablets, different side effects in order to then be eligible for these new injectable medications.
Which is really why you need to be friends with your pharmacist.
Yeah.
Things like side effects often impact
hmm
me as well. And it's like, is this
Yeah.
the drug working or is this a side effect?
Yeah.
That means it's working.
Especially with migraines. Like I feel like a lot of the medications we react differently to because of our migraines. So something that might be well tolerated by a general population, like the smallest change in our body, like just can flare migraines off and make them horrible. So it's quite challenging to try navigate that. And you don't know if you should push through the side effects and continue taking it to see
Mm,
benefit, or if you should listen to your body and stop taking it and
got
then
it.
try a different option. Yeah, it's quite
So,
frustrating.
on the topic of stopping taking medication,
Mhm.
I know sometimes your doctors will just take you off a medication straight away, whereas other times you have to wean off or taper off.
Yeah.
Is cold turkey ever really a good thing? Topiramate, I think, is the latest
Yeah.
one we've been hearing discussions on. So, what are your thoughts
Mm.
on that?
Yeah, like usually I would always recommend like weaning off the medication, unless you are experiencing like horrible adverse effects, then you might have a much faster decrease looking at stopping the medication. But yeah, generally we look at weaning the medication down, especially if it's been one that you've been on for a long time or something like that. But if it's, say, a newer medication, you've only just tried it, you're having really bad side effects, then it's generally okay to
Safe to
just stop
stop?
it a lot faster. But yeah, you always have to work with your GP or another doctor to
Yep.
look at stopping that medication. And it's just about having those regular appointments in that process to make sure you're not having any kind of troubles like
Major
from
dramas.
the withdrawals as well. Yeah. If that makes sense.
It does, but you're right. I'm just thinking of the medications that I've had to go through, and
Yeah.
I'm just thinking of the fun and games that I had. And we
Mm.
won't probably talk more about that. So
Yeah.
moving on then to the medication overuse headache. Now
Mm.
that is something that is a massive bugbear amongst our community.
Definitely.
How exactly does it work? So is it that if you take Panadol every day, you can build up a kind of an intolerance? But then if you maybe alternate it with, the Nurofen or something else, does that like break the cycle or does that all count too?
Yeah, it's quite a challenging like area to navigate. A lot of the times the most common kind of resulting medication that causes medication overuse headaches in the work I do is triptans, like the class of triptans. Like if people are using triptans like 3, 4, 5 times a week, then they're very prone to getting medication overuse headaches. I don't tend to see it with paracetamol. I think paracetamol generally is pretty safe to take continuously. Because, yeah, a lot of people do take paracetamol regularly to manage other conditions and they don't have any adverse effects from that. But then your anti-inflammatories is where it gets a little bit interesting. So if you
Got
do
it.
take it quite frequently, then yeah, they can cause the medication overuse headaches. So it depends on the particular medication. Yeah.
and the individual, which is
And the
why I always
individual,
say
yeah.
keep a migraine diary, and
And the
I
dose and
sometimes I
everything.
even keep track of all the medications that I take just because I don't remember. So
Sometimes, yeah, you don't remember. You literally, the doctor will ask you like, how many days have you used this in the last month? And it's
no
like,
idea.
no, no idea, gone. And I like look back at like my dispensing history and try work out how many boxes I've got, or look at my account and see how many boxes to try work it out. But yeah,
But if you're
can't
like me,
remember.
I have Panadol stashed everywhere. So
Yeah,
my bedroom, my handbag, my car.
exactly,
If you looked at
exactly.
how much medication I've
Yeah.
purchased, probably wouldn't be an
You
accurate
start
reflection.
accumulating more boxes as you go. You're like, you'll be out
I
and about and you won't have anything with you. So you get
that's
another
right.
one and then you get another
Yep.
one. And yeah.
And I visit my brother who I haven't seen in 6 months, and guess
Oh,
what?
yeah.
I've got
Oh,
Panadol at his place.
nice, nice. Yeah.
Kai, is there anything else that you want to share with us about Migraine Awareness Month or pharmacists in general?
No, I think just like remember that pharmacists are there and they're like an important tool like you can use to help manage your medications, help kind of optimize the regimen you're taking for your migraines, and also like if you want to look at preventative options, your pharmacist can be a good support while you're navigating the different challenges that come along with that. So, yeah, remember we're here. Please use us.
And pharmacists can help give migraine a break, and that's
Yeah.
all about this month, isn't it?
Yeah, yeah. And we're not as scary as people think. A lot of people see our white coats occasionally and then be like, oh my gosh, they're going to judge me. They're going to think this. But trust me,
The,
we
the
see
white coat
everything.
syndrome.
It's very real. It's very real.
Kai, thank you so much for your time today.
That's okay.
You have a great day.
Yeah, you too.